I'm Dr. Eric Anderson. I am Director of Interventional Pulmonology at MedStar Georgetown University Hospital. I see a variety of patients, from patients who need counseling on smoking cessation, patients who are at risk for developing lung cancer, those who have smoked cigarettes for a long period of time, and I also spend a lot of my time doing diagnosis and staging of patients who have been found to have lung cancer or an abnormal CT scan of the chest that may demonstrate a lung nodule or enlarged lymph nodes in the middle of the chest. I decided to go into pulmonary critical care medicine because of the multiple types of activities we can do each day, the multiple types of patients we can take care of, whether it's the critically ill in the ICU or the outpatient patients who have continuity for a long period of time, helping them make it through their problems. There hasn't been any great movement in the survival of these patients for a very long time. And now we're finally on the cutting edge of changing things. We are now being able to detect patients with lung cancer screening CT scans at earlier stage disease, stages where the survival is much better. We also have technology that has moved great leaps and bounds to help get the diagnosis for our patients. And we have even better technology now for the treatments. We have better radiation techniques, and now we have medications that can help patients with lung cancer survive longer, including patients who have stage 4 or metastatic disease. You want to come to MedStar Georgetown University Hospital because we have techniques in interventional pulmonology that will allow us to get you a diagnosis the first time. We have a team of experts who specialize in lung cancer only. We have thoracic surgeons who can use robotic surgery with minimally invasive techniques. We have radiation techniques that only Georgetown will have. We have proton therapy and we have CyberKnife radiation as options for treatment for lung cancer. And we have dedicated medical oncologists who are here to take care of your lung cancer with medications, whether it be drug therapy like chemotherapy, immunotherapy, or molecular targeted therapies. Patients who come in for lung cancer screening will meet with the nurse practitioner and have a CT scan ordered. The lung cancer screening CT scan is painless, it does not require an IV, and it takes only 15 minutes of time to perform. Your team will contact you within 24 hours with the result of the scan, so there's no long waiting for results. We know that patients who are at high risk of developing lung cancer are heavy smokers. We know that if they do a CT scan on a yearly basis, they can have an improved survival of at least 20% or even more. We also know that if you have a CT scan done once a year, if we find a CT detected lung nodule on subsequent years, you may be the person that we find in an early stage cancer with an 85% survival benefit, instead of waiting till it has spread to other organs and becomes symptomatic. The importance of lung cancer screening is that you do a CT scan on a regular basis and that we look for those small nodules, the nodules that don't hurt, the nodules that have not spread to other places. That's how we're going to change this disease, is detection of lung cancer when it's at its earliest stage, when it has no symptoms. Lung cancer screening should be done with the idea that you're at high risk. If you're still a smoker, we should also be tackling the cigarettes. Our team will help you. Our team will have a nurse practitioner work with you to help with smoking cessation. We strongly believe that doing the CT scan for lung cancer screening is only part of the job. The other part of the job is getting you assistance with smoking cessation. Lung cancer patients are not always patients who smoke. Sometimes there are genetic reasons for having a risk for having family members who had a secondhand exposure to smoke, or sometimes occupational exposures, uranium miners, patients who are exposed to radon inside their basements. These are all causes for lung cancer. There are cases where lung cancer is hereditary. We know now that there are patients who have genetic mutations that cause their lung cancer. Some of these patients should be screened as well, even patients who might not be a smoker. If your family member has died of lung cancer, you may be at risk for developing the disease yourself. The average age for a lung cancer patient is 74. We know this is not usually a diagnosis made at early age, but at age 50 or higher, patients become more at risk. If you are found to have a lung nodule on your screening CT scan, then the next step may very well be a biopsy. A biopsy done with the ion robot bronchoscopy and using the endobronchial ultrasound to stage the lymph nodes in the middle of the chest to make sure that they are not involved. The average age for a patient presenting with lung cancer is age 74. So we have patients as young as 30s, but we have many patients who are over age 80 who are coming in with a new diagnosis of lung cancer. There are multiple options for patients at both ends of the spectrum. It all depends on the stage, and now it also depends on the molecular abnormalities, the genetic makeup of the cancer cell. There may be drug treatments that are options for you. There may be radiation options for you, including CyberKnife for patients who are over age 80 who decide they don't want to have surgery as an option. We have 2 multidisciplinary specialty clinics for patients with lung cancer. Each Wednesday afternoon, we have a multidisciplinary thoracic oncology clinic where you can meet with the thoracic surgeon, the radiation expert in lung cancer, and the medical oncologist who specializes in lung cancer treatments, along with the interventional pulmonologist like myself. At one meeting at that same table, you will meet and discuss your case with each of the different physicians so that we can come up with a comprehensive plan at one time with one setting to help you get the best care possible. We also have a CyberKnife and proton lung clinic meeting with patients each Thursday morning. In that clinic, the radiation oncologist who specializes in CyberKnife and proton lung treatments meets with the interventional pulmonologist to discuss possible cases with patients who are interested in CyberKnife for lung cancer or proton therapy for lung cancer patients. The multidisciplinary clinic allows us to sit around at one table with the patient and discuss their treatment together. Lung cancer is a disease that needs a multimodality approach to treatment. And the only way that can happen is if you put all the doctors in one room to take care of you. If you've ever sat on the other side of the table where the patient is trying to find out what does this diagnosis of lung cancer mean, the best solution to that is to be able to meet with all the experts at once, to have them tell you each of the part of the treatments that they're going to handle and how the side effects are going to be, all at one time. Patients do this through other different hospitals in the region, and they'll go to 4 different appointments to meet 4 different people and find out that they need to start back with the first person because they have a question for the first one before they can start the next treatment. Our team will sit with you at one table, come up with a plan, and have it completely formulated right there for you at one visit. Having a multidisciplinary group work with you at a single visit allows us to get your treatment started as soon as possible and get all the questions answered all at once. Each case is different. We sometimes have patients come back to multidisciplinary thoracic oncology clinic because their case is complicated and it needs the input of all the different specialties. Sometimes we just need one person to manage them afterwards. Perhaps they just need the surgeon to go first, and the surgeon will take care of them. Perhaps they have disease that has spread to other organs, and they need to follow up with the medical oncologist only. We have this multidisciplinary thoracic oncology clinic available for newly diagnosed patients, especially patients who have advanced stage 2, 3, or 4, who have the needs of all the different disciplines to help with their treatment. I think across the healthcare system, we're seeing patients who have presented to us at a more advanced stage of problem. Whether it be a lung cancer problem or another cancer problem, it's being seen across the system. People have not been taking care of themselves for the past year. We need to make sure they follow up with their healthcare needs. They should be getting their screening done. They should be getting their colonoscopies. They should be getting their lung cancer screening CT scans if appropriate. They should be getting their mammography. We need to pick up these problems when they're earliest, when they're treatable, when they're curable. We can't wait until it's advanced stage and spread to somewhere else and become symptomatic. We encourage all of our patients to continue to seek their regular health care despite any pandemic.